Hi, I'm Laura Mize, pediatric speech-language pathologist, and welcome to TeachMeToTalk.com's Therapy Tip of the Week. On my website and on my podcast, Teach Me to Talk with Laura and Kate, I get lots of great questions from parents and from other therapists concerning pretend play. So many times it starts out with, I have this child and he doesn't understand pretend play. What should I do next? Let's be really clear with what an important developmental milestone this is. But we can't begin with something that's symbolic or way above where the child is cognitively. We have to start with functional objects and familiar toys and things the child has already used during his daily routines to begin to develop this kind of play, and then over time move him to that symbolic level. So today I want to introduce you to the things that I use when I'm working with a child like this and give you some tips that might make it easier. Nearly always start with baby dolls and again activities from a child's daily routines. Sometimes some of our little friends with developmental delays, though, don't like dolls. They could care less. So let me tell you that all of these activities that I'm going to show you today can be used with other things. You can pick a beloved character like Elmo and get a stuffed Elmo or a stuffed Dora, or again, pull from what you know the child already likes. You could use a really fun animal like my cute little mechanical dog here, and it's got some other kind of tricks and bells and whistles, but with this kind of play you're not really going to want to focus on that just yet, but you can use it if a kid likes it. Lastly, you may not think about using a toy like Thomas the Train. How many of your little clients on your caseloads, if you're a therapist, how many of you have little boys that are just obsessed with Thomas the Train and his friends? I've had lots and lots of them over the years. And this kind of play can even be done with something like Thomas. He's got eyes, nose, and a mouth, so that's good enough for me. So you can use these kinds of ideas to, again, hook a child's attention and get him to want to attend and participate with you. So I want you to keep that in mind as we're talking about these ideas. The other thing that's so important when you're beginning to work with a child like this is that you don't overwhelm him with too many possibilities. So if I were working with this kind of kid, I wouldn't have the baby doll and Thomas and Elmo to see what he likes. I would pick one of those things and then put the rest of your toys away so that he doesn't become overwhelmed. We see that a lot with our friends with developmental challenges. You'll have a lot of toys out, and one of two situations happens. First of all, he's there and he just flits around from object to object to object, and there's no real learning going on because his attention is not really with you, and he doesn't stay with one activity long enough to be able to watch it, to imitate it, to really take it in, and to learn the words associated with that activity. So you can avoid that problem by reducing what you present to him at one time. The second thing that happens when you use too many toys in a play situation is that the child can walk away. And a lot of parents misinterpret that. They think, oh, he's bored or he doesn't like this, when actually the opposite is usually true. He's overwhelmed. Those are too many options for him. So you really want to be careful in these early stages to reduce the number of stimuli or materials that you use with a child like this. So I would try to have a baby doll or two or whatever else you decide to use. Now let's talk about why you would want to use two dolls versus one. And again, you're going to have to gauge this on each child that you would see and what's going on. For some children, they can have a baby doll, you can have a baby doll, and you can model or show them or demonstrate what you want them to do. So for this situation, if I were working with the child, she would have her doll, I would have my doll, and I would begin with something, again, from her daily routine, like eating. A bowl and two little spoons are perfect for this kind of introduction. And again, be careful, if you're a chatty-patty person like me, and like most speech pathologists are, not to over-talk. What do I mean by over-talk? I mean where you just go on and on and on and mindlessly narrate every single possibility that you could come up with when you're playing with the child. And that is, it's such a temptation, but especially when the child isn't saying very much back to you, but you need to pull it way back for this beginning activity, because you want to make sure that you don't, again, overwhelm the child with too much language, and so that you're giving the child time to process and to learn what you're introducing. So for an activity like teaching a child to feed the baby, you would just simply model what you want them to do and accompany it with really simple language, meaning single words, play sounds, exclamatory words, just really simple words to help increase the child's attention to you and attention to what you're doing, and also keep it at that level so the child can begin to attach meaning. Most of the time with our children who exhibit delayed play skills, they also have receptive language delays, and they even probably have cognitive delays. So again, you're not wanting to overwhelm their little systems by giving them too much information. So you want to keep it really simple. And in addition to being really simple, you have to be fun. They have to want to stay with you and be with you. So you're going to model something like, ooh, eat, eat, baby eats, Can you see how that would keep a kid's attention? And that's much better than saying, oh, feed your baby doll with the red spoon. Now take another bite, baby. You give your baby a bite too. Can you see how a kid might get lost in all that mindless narration? Don't do that. Keep your words really simple and really fun. Another common action that you can teach a child how to do when you're introducing this play is to help him or her learn to imitate the stirring in a bowl. That's tons of fun for a toddler. I don't know why. Maybe because it's so simple. Maybe because it's novel. They haven't really seen an adult pretend to play like that before. But that's another great one that you can try. I don't know if I talked to you about keeping all your objects in a bag so that you can control them and not have them out. But that's certainly something that I do in every therapy session. And if you've seen any of my DVDs, you know that already. So then once the child has imitated this kind of scenario with you, you'll bring out the next item. All right, what happens if he or she doesn't imitate? After you model the action, giving the baby a bite or giving the baby a drink, and he or she doesn't copy you or imitate you, take your hand and put it over the child's hand and do what therapists call hand-over-hand assistance and help him perform that action. Now, a firm touch is much more easy for children to take than a light touch, especially for our friends who are tactile defensive. So be sure that you're not giving them such a light touch that it becomes ticklish. You'll see a lot of children who have real sensitivity to their hands being touched. So again, some parents misinterpret this and say, oh gosh, he doesn't want me to help him, or he doesn't accept assistance. Usually that's not it. Usually it's a sensory processing difference. So you'll want to give a little bit firmer touch. All right, what do you do in the kind of situation where you give a kid a baby and a spoon like this, and then he totally tunes you out? You've disappeared. In that case, reduce your items again so that you're just using one spoon, one bowl, one baby, and you're both attending to the same kinds of objects. Now, with this kind of activity, you want to start to see the beginnings of joint attention. Joint attention requires 3 points or 3 people. You as the adult, the child is number 2, and the object is number 3. So you want the kid looking at what you're doing, looking at your face, and again, participating together. If you bring out the toys and in your mind or in the child's mind, you've totally disappeared, That's not joint attention. So you have to keep yourself part of that activity. Sometimes that means being on the floor and really hunching over so that your face is right beside the baby's face. Sometimes that means if I had a toddler here with me, I might plop him right here on this table so that he is really looking at me as he's playing with the toys with me. If you're on the floor, you might put the child up on the couch or a low table so that, again, you can put yourself right in his line of vision to help him start to include you in his play. So, very simple things with introducing, helping a child learn how to feed a baby and give a baby a drink. You want to be simple, you want to be repetitive, and more than anything else, you want to be fun. I hope that you've enjoyed this therapy tip of the week. Join me next week because we're going to talk about the next step and what else you can do in setting up situations so that a child that you're working with learns how to do pretend play. Thanks so much.